Good day everyone, my name is Raja Imherda from the STM 1A. For today, I will discuss you what is anatomical movement. What is anatomical movement? Anatomical movement can be defined as the act or instance of moving the bodily structures or as the change of position in one or more of the joint of the body. Joints actions are described in relation to the anatomical position, which is the universal starting position for describing movement. So what are the basic anatomical movements? So, flexing the elbow to bring the radius and the rolls closer to the humerus. Figure 2, flexing the hip to bring the femur closer to the abdomen. Figure 3, flexing the knee to bring the tibia and the fibula closer to the femur. Figure 4, flexing the neck atlantocubital joint to bring the head closer to the chest. So there are 4 major categories of movements. So we have gliding movements, angular movements, rational movements, and special movements. So what is gliding movements? So gliding movements occurs when surfaces of bones more opposed are another in a linear direction but without significant rotary or angular movement. So they can help you to remember that the gliding joint movement primarily take place on the carpal and the rest of the tarsal of the foot. However, gliding occurs to the plain joints in the body. I have here a small video example of gliding movements. So let's watch this.
Hey everyone, this is Ben with RegisteredNurseRN.com, and in this anatomy lesson, I'm going to demonstrate a body movement term known as gliding. So what is gliding? Gliding occurs when the surfaces of bones move over one another in a linear direction without significant rotary or angular movement. The most common example of gliding is just simply taking your hand and moving it from left to right in a waving motion like this. And that can help you remember that the gliding joint movements primarily take place in the carpals of the wrist and the tarsals of the foot. However, gliding can also occur in the other plane joints of the body. And a simple way to remember which joints allow gliding, a plane joint, think of airplane gliding through the air, so the plane joints are going to allow gliding. And some examples of joints that do this are the sacroiliac joint of the pelvis, the acromioclavicular joint of the shoulder, the femoropatellar joint, the tibiofibular joint, the vertebral costal and sternocostal joints of the ribs, as well as the intervertebral joints of the spine. Okay?
Angular movement, swing or angular movement brings about a change in the angle between the long axis of the moving bone and some reference line in the fixed bone. Flexion, bending and extension, straightening of the elbow are example of swing. So I have here a small video of angular movement. So let's watch this.
Now let's talk about the angular movements, and I'll begin with flexion and extension. And I find personally that it really helps to think in terms of angles, because flexion is going to decrease the angle between two structures as they bend or move closer together, whereas extension is going to increase the angle between those structures as they straighten and move apart. So let's take a look at some examples of flexion and extension. Elbow flexion, also called forearm flexion, occurs when the angle between the forearm and arm decreases, allowing the ulna of the forearm to move closer to the humerus bone of the arm. In contrast, elbow extension, also called forearm extension, occurs when the forearm moves away from the arm, increasing the angle between those bones. Shoulder flexion, also called arm flexion, occurs when the angle between the humerus of the arm and the scapula decreases. In contrast, shoulder extension, also known as arm extension, occurs when the angle between the humerus of the arm and the scapula increases, causing the arm to move posteriorly. And the joint here allows posterior movement past the anatomical position. Flexion of the wrist, also called hand flexion, occurs when the angle between the palm of the hand and the anterior surface of the forearm decreases, while extension of the wrist or hand extension is moving the palm of the hand away from the anterior surface of the forearm. Hence, the angle increases as it continues to move beyond the anatomical position. Finger flexion occurs when the angle between the anterior surface of the fingers and the palm decreases, and when the angle between the fingers and the palm increases, finger extension occurs. Flexion and extension can also occur within the interphalangeal joints. Now, as you can tell up to this point, most of the movements with flexion and extension are going to occur within that sagittal plane or parallel to the sagittal plane. However, with the thumb, it's a little bit different. Thumb flexion is going to have the thumb moving toward the pinky, kind of parallel to the palm within that frontal plane, and thumb extension is going to have the thumb moving away from the pinky. And if you think of your palm as a windshield and your thumb as a windshield wiper, it's going to kind of go back and forth in that kind of a motion. Flexion and extension can also occur at the interphalangeal joint of the thumb. Next, we have hip flexion, also called thigh flexion, which occurs when the angle between the femur of the thigh and the hip bone decreases as the thigh moves anteriorly or forward. Hip extension or thigh extension occurs when the angle between the femur and the hip bone increases as the hip joint straightens. And just like the shoulder joint, this joint also allows movement past the anatomical position. Knee flexion, also called leg flexion, occurs when the tibia bone moves toward the femur, causing the angle to decrease between those two structures. Knee extension, or you could say leg extension, occurs as the angle between those leg bones increases, causing the leg to straighten. And just like the fingers, toe flexion and extension can also occur. Vertebral column flexion or spine flexion occurs when the angle between the trunk and the hip joint decreases, and spine extension occurs as the spine straightens. Neck flexion occurs as the angle between the head and the trunk of the body decreases, whereas neck extension occurs as the head moves away from the trunk of the body. And the neck is another one of those structures that can continue posteriorly beyond the anatomical position. The vertebral column can also experience flexion within that frontal plane. For example, if you bend the spine to the left or to the right, that's called lateral flexion, and movement back toward the anatomical position is called lateral extension. And then finally, I want to talk a little bit about hyperextension, because whenever a structure moves beyond a certain point, anatomists will refer to that as hyperextension. Now, what can get a little tricky with this is that anatomists will sometimes define hyperextension differently. For example, some anatomists will say that when the arm, neck, wrist, or leg moves past the normal anatomical position in a posterior motion, it actually becomes hyperextension and not just extension. Whereas other anatomists will only consider these movements hyperextension if the movement exceeds the normal range of motion permitted.
So the rational movements of the servo motor during scanning is converted into linear movement by specially designed mechanical structure, or drive the movement of the focus lengths, thereby adjusting focal length, and the focusing of the scanning points on the entire working surface is achieved by amplifying the focusing action of the dynamic focus lens via the object lens. Special movements are all the other movements that cannot be classified as gliding, angular, or rational. These movements include inversion, eversion, protraction, and retraction. Other special movements include elevation, depression, supination, and pronation.